Hello, everyone, and thanks for joining us to talk about a critical topic, the health and societal impact of obesity, and why it is so important to address. I'm Kelly Copes Anderson, Associate Vice President and Head of Diversity, Equity, and Inclusion at Lilly, and I'm excited to introduce you to the fellow advocates that we have with us today. Joe Naglowski, President and CEO of the Obesity Action Coalition, Dr. Fatima Cody Stanford, an obesity medicine physician, scientist, educator, policymaker at Mass General Hospital, and Associate Professor of Medicine at Pediatrics at the Harvard Medical School. And we also have Nadia Nazir Ahmad, Medical Director for Obesity Product Development at Lilly. Let's dive in. To set the stage for this conversation, Joe, let's talk about how obesity is defined and a bit about how your organization helps people living with the condition.
Thanks, Kelly. So no universal definition of obesity exists, which contributes to some of the issues we are going to be discussing about public perception. But for now, I'll share the World Health Organization definition, which says obesity is defined as excessive body fat that presents a risk to health. The definition of obesity is not body mass index or BMI, but a BMI of 30 or greater is usually a warning sign for most people. It's time to talk to your healthcare provider about your weight and health. Now, moving on to the OAC, the work of the Obesity Action Coalition, which I helped establish in 2005, has always been focused on helping those living with obesity to find better health. And we were actually created when a US legislator stood up in a meeting on obesity and asked who represented those living with obesity. One of OAC's core beliefs is care for obesity should not simply be seen as having the goal of just reducing body weight. That's where discussions like this play a particularly important role.
Wow, that is great work that's been done. Thank you for being a voice and advocating for people living with a condition that impacts so many. Now I'd like to turn to you for a moment, Nadia. Can you share an overview of obesity from a scientific perspective?
Absolutely. Thank you, Kelly. So I'm going to build off of Joe's definition that obesity is excess fat that is detrimental to health. I agree, very general definition, but if we can break that down a little bit. So the one component is that there's excess fat. And one thing to think about when we think about that there's 650 million people in the world today with a body mass index over 30 and 2 billion people in the world today with a body mass index over 25. So those are categories of obesity and overweight defined by body mass index. And so many of those individuals, if not most of them, have excess fat. And it's hard to think that every single one of them did that to themselves. Fat tissue is actually something in the body that is regulated. And so in obesity, if the body is developing excess fat, it means something has to have gone wrong with those mechanisms, that regulation that should normally happen and keep the fat at a certain level. So from a scientific perspective, obesity is a condition, a disease, because there has to be some sort of dysregulation or abnormality in the system that caused the excess fat. We know that obesity is associated with many complications, many comorbidities that can advance and progress over time, including metabolic disorders such as diabetes, hypertension, high cholesterol, structural disorders such as sleep apnea, physical mobility issues, and even many kinds of cancer. So it's a complex disease state with many implications.
Thank you for breaking all of that down for us, Nadia. So Dr. Stanford, based on what Nadia explained to all of us, these risks just mentioned have relevance before obesity is even reached.
Absolutely. While the risk is lower for individuals who have overweight and obesity, they do still exist. Intervention and prevention are critical when it comes to addressing the disease of obesity. Thankfully, advancements in technology like wearables and science-backed weight loss programs help with the behavioral side of things. But there's more to treating obesity than that alone.
I strongly agree with Dr. Stanford here. Based on a growing body of scientific evidence and the discussion we had about the scientific basis of obesity, we as a community are better understanding how this is a metabolic condition, not just a condition that causes other metabolic problems, but in and of itself, it's a metabolic condition. that can be targeted, it can be treated with medication. And so we're excited to see where our continued research on this effort lands.
Such valuable information. Thank you both for that. Joe, would you agree that research isn't the only area we need to focus when it comes to advancing obesity care?
Yeah, absolutely. There is unfortunately significant bias in the obesity space. And bias involves negative weight-related attitudes, beliefs, assumptions, and judgments towards individuals who are overweight or have obesity. This kind of bias poses a major obstacle to creating change.
Absolutely. And Lilly fully supports that position and recognizes that the burdens of obesity, both psychological and economic, are not equally shared by individuals.
It's unfortunate that the biases and stigma we still experience with obesity today have a devastating domino effect, from influencing decisions about insurance coverage to generally impacting care due to individual healthcare provider biases.
Yes, and to that point of bias, Lilly has conducted some research on this issue across key audiences, including healthcare providers, people living with obesity, as well as employers who decide coverage, insurance coverage on anti-obesity treatments for their employees. And we did this through a study called Observe. And in the first phase of this study, we did in-depth interviews with individuals in these different audiences. And we noticed, and our findings showed, that healthcare professionals, particularly primary care physicians, voice that they have discomfort around treating obesity in several different aspects. There's discomfort around having the conversation, even with the patient, bringing it up because it's perceived as a very sensitive issue. So how do we do that in a sensitive way? And will the patient then feel offended and not want to come in again? There's also discomfort around applying treatments, particularly applying anti-obesity medications in the management of obesity. And that stems from two different things. So there's discomfort there, in part because obesity is misperceived by providers as a lifestyle choice that does not warrant medication on one hand. And then there's another perception that perhaps anti-obesity medications, given the historical issues that have been faced in this therapeutic area, are not safe, or maybe they're not efficacious. And so we recognize that these are gaps that we really need to address and educate on as we bring a new potential therapy to the market in the future.
So as a physician, I truly appreciate that commitment, Nadia. I think another contributor is prescriber hesitancy, specifically secondary to older generation therapies that may not have always had the strongest outcomes. But as a specialist, I don't discount those existing therapies, but do agree that we need to gather more data to help shift these perspectives, which can influence moving the needle, which insurance providers need as well.
I am just loving this conversation and agree that hopefully, as we all continue to move the needle for perceptions around obesity, from research into understanding the science behind obesity and development of dedicated therapies, to patient advocacy and quality care, we can start to see even more progress. It truly is such important work. Dr. Stanford, with all of these biases, do you think it's reasonable to say these are barriers that influence a lack of unity when it comes to the perception of obesity as a condition?
Unfortunately, the answer is indeed yes. There is a portion of the population, both in the medical field and in the general public, who don't view obesity as a medical condition that can be treated through a combination of behavioral and drug therapy, but only as a result of lifestyle choices, is what they believe. This is despite scientific evidence that obesity is a chronic disease, an acknowledgement of risk factors that we've already discussed today. As someone who works closely with patients living with obesity, this sentiment is something that I feel very passionate about changing.
We feel the same. And to Nadia's point, we've seen some progress and are committed to researching potential treatments indicated for obesity, while also recognizing that bringing dedicated treatment to market is a longer-term goal. In the meantime, we are doing what we can here and now to help improve the lives of people living with the condition by advocating for support through policy and other key stakeholder groups.
Now, I can say we really are excited to see more people getting involved in this important work. Can you tell us a little bit more about what Lilly is doing?
Happy to. As you know, right now, obesity isn't parity with other chronic conditions. In terms of insurance coverage and reimbursement in the U.S., yet estimates from the Milken Institute show that the annual economic impact between obesity and related health costs were totaling $1.4 trillion. Despite the evidence and recommendations for a combination of medical and behavioral therapy, coverage of anti-obesity medications remains fairly limited. We're hoping to influence change in that area, making this the kind of change that will help ensure a more comprehensive set of care options that goes well beyond behavioral measures like the inclusion of anti-obesity medications and hopefully drive down some of these costs.
This is frustrating, but really true. Data from a study in 2018 actually showed that among 136 health insurance plans, only 11% had some coverage for anti-obesity medications in only 9 states. And this data is likely to change with new therapies that are now on the market, but it still represents a long-standing historical problem.
I'm familiar with that study. I may have designed it. Plus, Medicare policy strictly excludes drug therapy from obesity. And many state Medicaid programs lack coverage for obesity medicines as well, which really disproportionately impacts those of low socioeconomic status, groups that are more likely to have higher rates of obesity. All in all, it makes prescribing that much more difficult when people can't afford these medications and treatments.
And that's exactly why supporting the Treat and Reduce Obesity Act, also referred to as TROA, is critical. For those watching who might not be familiar with this essential legislation, it is aiming to improve access to counseling for obesity and add FDA-approved anti-obesity medications to the Medicare Part D pharmacy benefit.
This work is so important, and it takes a village.
Any treatment that is brought to patients is only going to be as good as the environment in which it is brought, right? And so in no way do we discount the impact that the larger environment has in causing obesity. It is in fact that environment that interacts with our normal biologies to then cause the disruption that causes the obesity. And those environmental factors, unfortunately, are not distributed in our society today in an equal way by any means. And in fact, the environmental influences or contributors to obesity are disproportionately distributed in those in lower socioeconomic areas. They're disproportionately distributed amongst people of color. And so it's no wonder that we see disparities in obesity with individuals of low income or individuals of color having higher rates of obesity. And so recognizing this, Lilly really does support efforts to increase our understanding of the influence of social determinants of health and to improve access to meaningful coverage in communities of color, as well as initiatives to improve the health of minorities, especially when it comes to prevalent chronic diseases.
What a great discussion. That marks the end of our panel today. Thank you all for your time today and for your efforts in supporting people living with obesity. We look forward to continuing this conversation with the broader community and working to spark more positive change with you, our partners.